For the last 1 week, the country has known no peace as political leaders competed over who could shout the loudest about Linda Mama versus Linda Jamii. Fascinating how every politician who found a live microphone rushed to tell their version of the truth, most of it less about healthcare, more about scoring points against former President Uhuru Kenyatta. And when darkness fell, the same politicians sped home, not to miss the evening bulletin, eager to watch how grand their performance had looked in our increasingly reactive political culture. But now the week is over. Then what? Behind the soundbites are real lives. Millions of Kenyans remain without medical insurance. Hundreds of thousands depend solely on their nearest health facility, and in most cases, near is not near. Over 3 million citizens are now over 60, many with no predictable income, battling chronic illnesses that demand continuous care. Meanwhile, our health system suffers the shortage of medical specialists. Those available are too costly for ordinary families. Now, until mid-2024, poor mothers could still count on Linda Mama for free deliveries, including by cesarean section when needed. The program had its flaws, facilities underfunded, reimbursements delayed. Yet, if the government reports were to be trusted, at least 1 million mothers benefited each year. Maternal deaths reduced, infant mortality declined, outcomes improved. And now the government points to the Primary Healthcare Fund, which also finances free maternal care at some level. But facilities complain of insufficient funding, delayed disbursements. Medics question where SHIF kicks in at the lower levels of care, if at all. Meanwhile, mothers are being detained for unpaid hospital bills, the very problem Linda Mama was designed to address. This is the reality politicians ignore when they grab the microphone. The essence of public policy is to serve the people. When serving leaders spend more time competing with retired leaders, what do you call that? Imagine Form 4 candidates this October calling a press conference during one of their KCSE breaks to mock last year's candidates for failing chemistry. And as you imagine that, Kenyans are not asking which scheme has the better name. They want a health system that works, where healthcare workers are present, diagnosis is accurate, prescriptions correct, medicine available, outcomes favorable, all at a predictable and affordable cost. As we speak, many county governments have certain unresolved grievances with their doctors, nurses, clinical officers, laboratory technologists, and more. Patients queue in uncertainty as the politicians play. No Kenyan patient has asked what's better between Linda Mama and Linda Jamii. All they want is to get well. Perhaps it's time leaders took more breaks from the game of politics to fix the pressing challenges that threaten the lives of Kenyans more than they do to political careers. That's my sense tonight.